Hi everybody, today we're going to go through a lower body foam rolling sequence. This is such a powerful tool for releasing tension in your body, and it works by gently compressing your muscles and your fascia for an incredible release, not only through the muscle tension but also through the connective tissue that holds tension, your fascia. So I'm just going to show you some basic release techniques that can release the tension that's living in your lower body. And usually when you have tension in your lower body and you're not aware of it, what happens is you end up having pain in another area. Like, for example, your knee might have a bit of pain, or your hip might have a bit of pain, or your back. So we're going to start out by rolling out our quads to get started, and we're going to go over just a couple major areas that hold tension that can contribute to knee pain, hip pain, back pain, any sort of joints that are connected with those muscles. So you are going to need a foam roller. Please have a smooth one. The bumpy ones are, I'm not sure actually if I'm a fan of the bumpy ones. I'm not a fan of them. The only issue with that is a trigger point that needs to be pressed. They have too many bumps and it ends up pushing into your spine and pushing into your bones, and that's not what you want with this tool. Instead, you want a nice smooth surface, and it's going to be, effective enough. You're going to feel it enough if you're doing it correctly, all right? So we're going to start by coming down onto our mat. We're going to take the roller just under our pelvis, and we're going to open our legs a little bit apart here so that when we start rolling, we can really slowly use our toes and our elbows in a little bit of an army crawl. And even in this position, keep your core engaged. And we're going to roll down our quads until we meet the top of our knee. And now you might notice an area that's a little bit tender. Don't go on the kneecap, just go to the top of it. Even feel free to move your feet a little bit side to side in case you notice some tension. You might notice, I call it just like a tense knot, or it feels kind of like a chunk of hard muscle tissue. And that, if you notice that, that's going to need a little bit extra attention here. So if you notice an area that's extra tense, spend a little bit more time on that area. Spend a little bit more time rolling it out. Also try to incorporate a little bit of breath while you're doing this. Sometimes it can be quite tender. So try to inhale through your nose, nice deep breaths to encourage your body and your muscles to relax. So a big inhale through your nose, and exhale out through your mouth. And the neat thing about foam rolling is you want to spend a bit of time. You want to spend maybe a minute or 2 minutes in one area, because as you're rolling, you will start to loosen up surface muscle tension, and you'll notice that it feels a little bit different. It starts to get a little bit different, a different effect and a different massage through the deeper muscle fibers. So you'll notice all of a sudden you feel the stretch a little bit deeper. And that's an important thing, because you want to loosen up the surface muscle tension on those muscle cells on the top, kind of the outer portion of your muscles, and then work your way into the deeper muscle fibers and muscle cells, as well as the connective tissue, which your connective tissue, it's not just on the outside of your muscle, it goes in through your muscles. It webs in through your muscles and around all your muscle cells and muscle fibers. So stay here for about 1 to 2 minutes, rolling out those quads. And then if you want to make it a little bit more intense, you can bend one knee, really pushing your weight into the roller, and then switch to the other side. And again, you're kind of discovering your own body and the areas that are tight within your body and working with that the best way you can. I feel like this tool is just like having a massage therapist. It's incredible. So if you want to go a little bit more intense, we can actually get from the quad into the hip flexor. So if you were to take that roller and bring it over to one side, so we're going to bring it over to the right side, the left knee is bent, but you can comfortably kind of lie on the ground, pushing gently your right hip flexor and right up to the top of where that your quadricep muscle connects into your hip. And if you want to try to roll out there, this is an area that can hold a ton of muscle tension. So you can start by rolling out towards the top of the quad. And even with this one, if you bend the knee, it stretches the muscle fibers. So it's like flossing the muscle. You get a little bit deeper if you bend the leg and stretch in that way. Massage deep into that quad, going right up into the hip flexor. And your hip flexor is connected from the hip up into the back. So this will release tension not only in your hip but in your back because it's all interconnected. And then once you roll that out a few times, and even when you're doing this, I encourage you to keep your core engaged just to keep stable through your abdominal muscles. You can go maybe a little bit further down the leg to the top of that quad. You might notice there's some tension hanging out there. So now you're really isolating that one side. And if you bend your knee, it's going to be just a little bit more intense. But try to stick with it. Try to breathe through it. Try to stick with it. And take your time there. And the quad is 4 different muscles going from the inside of your leg to your outside. So if you position yourself so that you're rolling more on the inside of your quad, kind of like your adductor muscles, or if you make it more medial or towards the outside, you'll feel that the areas are all really unique. And some might surprise you where it's holding tension. All right, now we're going to move over to the other side. So we're going to take our foam roller over to the other leg. So the right side now is just like bent, comfortable, kind of in like a recovery position. You're going to take the left quad right up into the hip onto that roller, and you're going to start rolling out the left side, just like you did on the right side. Start at the top and work your way down. And another important aspect is to keep that core engaged because you are going deep into the hip and you're arching through your lower back. So don't just put pressure on your lower back. Keep that core engaged while you're doing this. Try to incorporate some relaxing breaths. So inhale through your nose and exhale through your mouth. And however you want to place your hands to feel comfortable in this stretch, go ahead, whether you're on your elbows or on your hands, if you have yoga blocks. If you start to bend through that knee, it's just going to stretch through the muscle fibers and make the roll and massage a little bit more intense, which could be a good thing depending on how you're feeling. And you can position yourself to go a little bit deeper if you want to roll right into that the top of the knee, the quad that connects, the little muscle fibers that connect right into the joint of the knee. Another area that can hold a lot of tension. Again, if you want to make it a little bit more intense, you can bend the knee. See, I don't know why people would want to use the pointy, bumpy foam rollers for this because this is already, if you're doing it properly, it's already such an intense massage sensation. Okay. All right, so another area we can go after that, again, holds tension up into the knee that we might not even be aware of is our shins. So if we take our shins onto the roller, and it's almost like we have our knees to our chest. You're not trying to do an abdominal workout here. I just want you to have your toes down, you're rolling forward, rolling out the top of that shin, then rolling yourself back. Breathing here, taking your time here. Sometimes this area can be surprisingly tender, but there's times, runners will get shin splints. They're actual muscles here. They're called your tibialis muscles, and they're just in front of your tibia. So from there, we can move into the IT band. Now this one is also known as a fairly tender area to be rolling and massaging out. You come on to your right hip. You take your left leg in front so that the left leg can support you. Obviously, the pressure is going into the side of the hip. This is also the lateral aspect of your quad. And supporting yourself with your arms, maybe your elbows, rolling down towards that knee. And again, you're just positioning your body so you can roll up and down. This area typically is quite tender. So just go slow, take breaths. Again, I don't know why you'd want to use a roller that has bumps, because it would just be it'd be such an aggressive massage. I recommend, one of these really simple, inexpensive tools. Now, another thing that rolling can do is increase circulation. It can soften out your muscle tone. It can help increase recovery, because sometimes tightness and scar tissue will cause issue with your muscles. It will inhibit them from getting stronger. If you're someone that's concerned about the visual appearance of your legs, rolling out your legs loosens up the connective tissue, and things like cellulite or uneven skin is typically just soft fat tissue pushing through connective tissue. So if you loosen up the connective tissue that the fat is pushing through, it creates like a softer look of the legs. So again, 1 to 2 minutes on each area. I'm going to switch over to the other side. If you're someone that has joint pain, if you're someone that suffers from knee pain, this is something that you should definitely be incorporating into your lifestyle. So we're rolling down the quad to the knee, and then we're taking it back. And again, you can be on your elbows, on your hands. You can go from one to the other. Just make yourself as comfortable as possible through this somewhat uncomfortable stretch and roll. When I was a personal trainer, in the gym, oftentimes we'd have clients come in and we knew that they had an injury, or we knew that they had an area of their body that was, tight. Before they even stretched and warmed up, they'd foam roll it out. They'd get rid of that tension. They'd break up that scar tissue, and they'd do it every time they'd come in. And it would have incredible effects. You might reach a time where you don't have to do it as often. That's typically the goal. But again, as we age and as we keep doing more and more things to our body, it's important to remember to look after our body. All right, and then last but not least, we're going to come into the hips, the external hips. So right on your bum, right on the roller, we're going to cross the left leg over the right. We're going to lean into the left side. When we do that, when we cross our leg over, it actually opens up what's called our external hip flexor, so that we can lean into that left side, lift our right buttocks and hip off the roller, and really focus gravity in the weight of our body, massaging and pushing into that left side. If you're someone that's had sciatica or any tightness within your hips where you can feel maybe a little bit of hip pain or back pain, this will be really, really beneficial for you. So again, my left leg is crossed over my right. The knee is externally rotating out, so I can open up in through that left hip and really getting into those hip muscles, which is basically your glutes. And if you notice like there's a knot, if you notice you're rolling and you feel like some really hard muscle tissue, that needs your attention, because that means that tension is just sitting there every day, pulling on your hip, and you're not really aware of it. This one can be tender, but it can also feel really nice. Then we're going to switch over to the other side where we're leaning on our right hip. We're going to cross the right leg over our left. We're lifting our left hip and buttock off the roller and rolling into that right side. And you might notice too that one side is very different than the other. Now the goal of this, 15, 20 minutes of rolling is that when you stand up and you perform a squat, your body feels really good, really healthy afterwards. It feels fluid, it feels pain-free, it feels flexible, and there's no pain in the joints. So when you finish that one up, come up into a standing position and just test out a squat for yourself. See how the knees feel. See how the hips feel. Chances are they feel much better than they did at the start. Thank you.